Implanted ports are game changers for people needing ongoing IV therapy. And with over 5 million ports placed in the US alone each year, it's pretty important that you understand their mechanics and why they're used. Very misunderstood. Ports go by various names, which sometimes adds to the confusion for new doctors and nurses, or even patients if you're told you need one and you're doing online research. Depending on your facility, you might hear them called portacaths, mediports, chemoports, TIBATs, or totally implanted venous access devices, and power ports just off the top. The one thing they all have in common is they provide direct and easy access to venous circulation. Now, there are other types of ports that are used for various reasons, like epidural and intrathecal ports. But here, we're just focusing on venous ports today. So what are they exactly? We're going to start with the port body, which is a small round shell made of materials like titanium, stainless steel, and plastic, and some will be a hybrid version of these. Generally, they range in size between a nickel and a quarter. Pediatric ports will, of course, be on the smaller end of this. You'll also sometimes see a dual chamber port, which contains 2 separate ports side by side in one housing, and each can be accessed at the same time to run 2 completely incompatible medications simultaneously. So all of the parts and mechanics that I'll be going over will apply to all ports because they're all the same. And I'll get to this mystery category shortly, but for now, we're going to leave that open. So this body houses the septum and the reservoir. The septum is typically about the size of a dime, maybe a bit smaller, and it's made of a self-sealing silicone, meaning after each needle removal, the puncture area closes back up. And this is key because ports are intended for long-term use, months to years. So if each time we inserted a needle, it removed or cored a piece of silicone out with it, then this would eventually lead to leaking and render the port useless and even dangerous to continue infusing through. So that's why we only use certain needles, which I'll get to in a little bit. On average, a silicone septum is designed to withstand anywhere from 1 to 2,000 needle sticks before it would need to be switched out. So just below the silicone septum sits the reservoir, which is a small chamber within the port body that holds the medication before it enters the catheter. And you might be asking, well, what's the point of this? Because the medication is going into the catheter anyway. It's such a small space. And you can think of the reservoir as a staging area. When the medication is delivered from the needle, it first collects here, allowing for a more consistent and controlled flow. It helps to regulate the pressure as it enters the catheter and subsequently the bloodstream. And then from here, we come to the catheter, which connects to the port reservoir by this little piece called the reservoir outlet. Some port brands come with the catheter already pre-connected, and then this area is reinforced to prevent catheter fracture or disconnection. So catheters range in size from 5 French to 9 French, but what is the difference between a French size and a gauge? Because you'll see both in infusion. So gauge indicates needle sizing, 18 gauge, 20 gauge, 24 gauge, but the size of the number is inversely proportional to the size of the needle. So an 18 gauge needle is pretty big, whereas a 24 gauge needle is actually kind of small. And the perfect representation of this inverse relationship is a butterfly needle, and it's considered quite small. And I'm sure if you've had blood drawn, you've asked for a butterfly needle. French is also a unit of measure, similar to gauges, but it's commonly used to denote catheter size. The French system is actually pretty simple. one increment on the French scale is equal to 1/3 millimeter, and it denotes the external diameter of the catheter. But there is one major difference. So unlike gauges in the French system, the higher the number, the larger the diameter. So they're directly proportional. 5 French is a smaller diameter catheter, and it's used for pediatrics or smaller veins. 6 to 7 French is standard for most adults, and this balances the ease of insertion with sufficient flow rate. So it's kind of like the Goldilocks of catheter sizes because it's adequate for most people. And then an 8 or 9 French is a larger diameter catheter, and it's used for patients requiring high flow rates. Catheter materials can be either silicone or polyurethane, and each has its advantages and disadvantages. So silicone catheters are less prone to thrombosis or clotting and are very flexible, but they can have a higher incidence of kinking and are not compatible with certain chemo drugs due to them weakening the silicone over time. Polyurethane catheters, on the other hand, tend to be stronger and more resistant to kinking, but this quality also makes them less flexible, so the catheter is a bit more rigid. They're also chemically resistant, so they don't wear down as easily with harsh drugs as silicone does. And then the last distinguishing characteristic here is that they're suitable for high pressure injections. And I'll explain what that means in a sec. But because of all of these qualities, they do have a drawback, which is that they can be more prone to causing clots. So 2 major categories that all central venous catheters fall into, ports included, is that they can be open or closed-ended. An open-ended catheter looks like the end of a drinking straw. Blood will sit here and it's more susceptible to clotting because of that. A closed-ended catheter has a dead end with a built-in valve mechanism, which is usually a split along the side that's pressure activated. So the valve opens out with positive pressure, such as with an infusion or with flushing, and conversely, it'll pull in on itself with negative pressure, allowing for the aspiration of blood. Without either of these, it remains closed or neutral. And this is important for a few reasons. First, it requires less frequent flushing, normally only every 3 months when not in use versus an open-ended port catheter, which needs flushing every month. Second is it cuts down on catheter occlusions from fibrin building up at the catheter tip. And therefore, it also doesn't require heparin, only 10 cc's of normal saline to get the job done. Now, are they perfect? Absolutely not. There have been multiple studies looking at open versus closed-ended catheters in terms of infection, clotting, and other issues, but these are 2 of the biggest differences. One distinction I haven't touched on yet is a third category of general port types. So we're going to go back to our original drawing for a sec. All right, so recall we had the single lumen port, the double lumen port, and this mystery spot that we left open earlier. And this is designated for the power port, which is a specific brand made by Bard. And this has the added benefit of being specifically designed to withstand the higher pressures that are required for injecting MRI and CT contrast. Power ports are made with more durable materials like polycarbonate and titanium and can handle pressures up to 300 psi. And this is what it looks like. Everything is the same as with any other port, but with a few key differences, namely the shape. And you'll also have these 3 little bumps to make palpating it through the skin easier during access. And we also can't talk about ports without talking about the specific needles needed to access them. And these are referred to as non-coring or Huber needles, which is a specific brand made by BD. But very much like the power port denotes a power injectable type device, Huber has become synonymous with this type of non-coring needle in general. So recall that the silicone septum is meant to self-seal, so we cannot use a regular needle because it would destroy its integrity. Koki, you want to say hi?
We'll be right back after this message.
I'm gonna lose my mind.
So I have my neighbor vacuuming, I think. It sounds like a vacuum. And then I have the dog. Oh, you're back. Care to say hi to everybody? No, I really don't want to pet you. Come on. Do you want to say hi? Come here. Come here.
Sure.
Say hi. Yeah, Joe, you're being incredibly annoying. Yep. This is Coco. I know you're trying to, scoot off my lap, but you've interrupted this video about 18 times now. So, yeah, you're going to stick it out and say hi to all the YouTube people. Yeah. There's a lot going on outside, I know. You're hearing a lot of things, so am I. And it's extremely annoying, but for the love of God, please just let me finish this.
Press that play button.
So a Huber needle has a beveled tip, which is just geek speak for it's cut a certain way. And it is bent at a right angle, which helps secure it in place and reduces the risk of dislodgement during use. So it lies flat against the chest, but the needle is still long enough to reach the back wall of the reservoir during access. And when your Huber needle is too long, it can stick up way too much and will cause tenting of the dressing. And then this will lead to your dressing not being inclusive and possible contamination. If it's too short, it might not seat properly within the reservoir and cause flow resistance because part of the needle might be just not clearing the silicone septum. And you'll go to flush and it'll be a little hard to do that. Or you'll go to pull back and you might not get any blood return. They come in various sizes ranging from 19 to 25 gauge, and they're available in different lengths as well, from 1/2 inch all the way up to 1.5 inches or more, actually. Now, many of these needles also come with safety features to prevent needle sticks, and these mechanisms shield the needle tip as they're pulled out of the port like this. So why choose a portacath? Why are they used? Because they require a surgical procedure unlike other catheters. And there are actually several reasons. The first and most obvious is someone is chronically ill and requires complex and ongoing therapy, which can be chemo, blood transfusions, antibiotics, TPN, IVIG, pain management. A port will greatly reduce the number of needle sticks and wear and tear on smaller peripheral veins. And coupled with that is if a patient has poor peripheral access, tiny veins, sclerotic veins, and these patients normally go through years of therapy and reach a point where they just can't take another fishing expedition with multiple IV sticks to get their treatment. So they'll go to their doctor and say, this treatment is helping me and I'd like to get a port placed. Or it can be proactively suggested by their physician in anticipation of a complex therapy ahead of them. Frequent blood draws can also be added to this list, such as in the case with HIV, AIDS, and cancer. It just lends itself to an improved quality of life in these cases. And then finally, there are certain medications that just cannot be infused through short peripheral catheters due to their pH or high osmolarity, such as in the case with TPN or total parenteral nutrition. Some meds are considered vesicants, meaning they can cause severe tissue damage and necrosis if they leak into the surrounding tissue. So in these cases, certain therapies will automatically require a central catheter placement. And right about now, you might be asking, just how much of a difference is there between, say, your antecubital veins or the veins in the bend of your arm where blood is normally drawn and central circulation, which is considered the superior and inferior vena cava, the subclavian veins, the internal jugular, and the brachiocephalic veins. So on average, the blood flow in your antecubital veins, okay, so these right here, is only about 2.5 to 8.5 milliliters per minute. And this cup holds 10 milliliters. So you can see not a lot of blood. In contrast, the blood flow in your superior vena cava, which is the major vessel leading into the right atrium, is 2,000 milliliters a minute. So 2 liters of fluid. This area here is where the tip of a central venous catheter terminates. So the lower third of the superior vena cava, also called the cavo-atrial junction. And this just leads to much greater hemodilution of these harsh medications. So the medication is ejected from the catheter and is immediately met with a large and turbulent amount of blood flow, which then further disperses the medication throughout the body from there. The best thing about portacats is when they're not in use or in between treatments, they don't require a dressing, and you wouldn't even see it unless someone has their shirt off or is wearing a tank top or a bathing suit. They are very low maintenance and they're very low profile, but accessing them requires skill, and maintaining and troubleshooting them definitely requires a solid understanding of the guidelines and complications that can arise and how to recognize them. So click this next to learn how to access and troubleshoot ports like a pro. I'm giving you all of the IV team secrets. So don't tell anybody.